Wow, what a great session. Thank you so much for your presentation, John. Okay, well, we're going to have some fun now. So firstly, I would like to introduce my co-chair for this session, Dr. Zisis Kozlakidis. I'm going to say Kozlakidis. Did I get that right? Was it close enough? Welcome, Dr. Zisis. So Dr. Zisis Kozlakidis is the head of Laboratory Services and Biobank Group at the International Agency for Research on Cancer. So thanks for joining us, gentlemen. We've been flooded with questions, as you can imagine. The organisers of the event sent me a WhatsApp message and they said from the various different platforms that this event is streaming out, there's about 500,000 people watching right now. So no pressure or anything like that. We'll just have some fun with this. So I'm just going to throw out some questions that have come through. And again, thanks everybody for sending your questions in. We really appreciate it. It enables this forum to be much more interactive than you just sitting at home in your PJs listening. So it's great if to send in the questions. So the first question I will throw to you first, Arif, and that came in from someone asking about wearable technologies and how do wearable technologies contribute in digital epidemiology accurately, considering that many devices have their, well, this person said their own accuracy. So whether it's heart rates or step count or oxygenation levels. So what are your thoughts on the epidemiological aspects of wearable technologies, given their variability?
Yeah, I mean that's a great question, and unfortunately, one of the things that I had mentioned in my slide is that there are some negatives to these wearable devices. There's really no particular standards that are sort of the companies that make these devices. They're really not tied to any. I mean, they're not part of the covered entities. So in which case, I'm not sure. Like, I mean, each one of us has an agenda, right? So the question then is, what exactly are we doing with that data? And I honestly, like from an epidemiological perspective, it's very hard for me to say how valid are the outputs of these devices. Now, we have in the pandemic we purchased 2 pulse ox devices for our family members, and from the same company, and they generated 2 different results. In terms of the measured outputs. So I'm not sure. It's very hard to say. And what I will say is that I hope researchers, epidemiologists can work very closely with some of these companies, to perfect the systems that are being produced.
Yeah, it is an issue, isn't it, regarding the standards that we associate with technology, whether it be hardware or an app. What are your thoughts? And I'll throw firstly to yourself, John, on this one. You talked a lot about mental health and well-being. If any of us go to our app stores right now and search for mental health, you're going to get like a zillion responses of apps. And as far as I'm aware, there is very little standards when it comes to clinical governance standards of these wellness apps. How do you envisage the future looking where we can provide some sort of validation to these tools? John?
Yeah, I think that's a good question, and I think it will happen. So we've all got to look at other examples of technologies that have been that are calibrated. Technologies that are used in hospitals are regularly calibrated, regularly checked, normal ranges, go through an audit process. I think that the same thing will happen at some point to the apps that we buy online, much of which at the moment, of course, are hugely unregulated. I'm not sure how that would work with a mental health app that doesn't particularly have scientific ranges and numerical values in the same way as some of the other clinical applications do. I'm sure some smart person at some point will sort that out. So, the answer is yes. I'm pretty sure that we'll see that online calibration, online governance of these devices in the future.
All right, thank you for the feedback. Zisis, you live your life in cancer research and biobanking. What comments do you have in regards to how you see like the idea of the research that we usually do in cancer? So I'm thinking we should rephrase that. So in cancer research, we follow very strict guidelines regarding how that research is done, and those systems have been perfected over many years. Do you see a role for wearable technology, sensors in the environment, so being able to gather data that could actually advance our understanding of cancer and how people live with it?
Yes, absolutely. There has been a notion of the exposome that's been put forward by the International Agency for a number of years, which means cancer is the combinatorial result of a number of exposures that we receive over a period of time as we find ourselves in different environments or different situations. And one of the ways in which we can get a handle on these exposures is through the utilization of wearable devices, where we can measure all these exposures in some way. However, again, it comes back to what John has said, the standardization and being able to compare against the data from the different data sets is a big issue for me.
Yeah, it is an issue. Yeah, that's right. And Arif, back to you on a similar topic as well. So a lot of the wearables that we use, I'm wearing one now. Hands up, all of you at home who are wearing one too. So if these are consumer, yep, okay, thank you, John. Yep, okay, we're all wearing one, at least one at least. And of course our phones.
I'm not.
Oh, you're not? Okay then. Well, I then have another question, but I'll follow up with that. So firstly, what I wanted to ask you was that most of these wearables are consumer grade technology, and we are seeing a push from those companies that own those devices to move towards more medical grade. What are your thoughts about the progression of, because the good idea with consumer based technologies is it makes it more affordable, they become more ubiquitous, but if they're not sort of taken seriously by the medical profession, then their utility is going to have little utility, actually, isn't it? If it's not used by the medicos. So, do you see that progression happening in terms of that transition from consumer grade devices to medical grade devices that are still ubiquitous?
Yeah, I mean, I do see a progression in that, and I really hope that it does move towards that. I've always believed in. I mean, I work in academia. I mean, that's where I've spent most of my life, and for me, quality is everything. So if we don't produce quality products, they say garbage in, garbage out. So if we can have standards put in place, and if companies. If commercial companies can produce high quality products, that's great. But in most cases, everybody likes to not everybody, but there are a number of people that like to cut corners, and they focus more on the profitability more than anything else. So that becomes their priority. But I think having put these standards in place, I think is a step in the right direction. And going back to your first question, I hope when these standards are put in place and these companies can work side by side with scientists, I think we can, our data will be much better, and I think we'll be able to make much strides in healthcare in terms of improving patient outcomes.
That's great. And for a question for all three of you, and I might throw to you Zisis first on this one. So from what you said, we need to have the commercial-based companies that are producing these devices working alongside the scientists. Now, traditionally, scientific research takes a really long time, and because of the quality issue and the standards that are followed in that. So that takes a long time. In commercial circles, we have every quarter we're measuring our outputs, we're measuring our revenue cycles, our expenses. Is there a way for those two worlds to, instead of colliding, actually work closer together? Can we change with appropriate, without walking away from quality standards? Can we change the way that research is conducted in terms of its time frame without sacrificing quality so that it aligns more to commercial outcomes? So question for yourself, Zisis first.
Thank you. I believe we can do. We need to be a lot more open on either side of well, in my view, it's the two sides of the same coin. So we need to be open to collaborate a lot closer and right from the outset. One of the reasons why the delay is happening is because we go back and revisit a lot of the data that has been collected in ways that is not useful, it's not meaningful academically, but yet it has been producing data, it's been collecting for a number of years. If the discussion was to be had right in the beginning, we would have saved a lot of time in that respect. So I don't see an issue in people working together. I think there are some very good examples where this has happened. The challenge that I see is in having the right frameworks to allow this work to happen, not just as part of one project, but to be happening all the time as part of our routine engagements in research and in the private sector.
Thank you. John, would you like to offer a response as well?
Yeah, a comment really, Louise. I think it's about fit for purpose and risk management. So I think there will be a market, quite rightfully, for devices that are very precise and that are of medical quality, and they will be used for certain audiences within a certain market. There will be other devices where that level of precision and quality probably isn't required. So the reason why my 6 important people were all very successful in using what they used was because the level of precision was relatively low. The level of quality was relatively low. So it didn't matter during a family quiz if the Zoom dropped or something of that nature. However, if it was a different set of circumstances and the risks were very different, then absolutely precision would be required, and we would want these devices to have undergone quality standards and be of medical quality in order to use them successfully and with confidence.
Thank you. Arif, would you like to comment as well?
No, I mean, I think John summed it up very nicely. Yeah.
Okay, then great. All right. Well, then we'll have another question. Do all of you, and again, a question for you all, so you can think about your answer, and I'll reverse the order this time around. So how long is it going to be before we go to our local general practitioner or our local hospital, for an appointment, and instead of getting prescribed traditional treatments only, we get prescribed an app and we get prescribed a wearable? So how long is that going to take? Okay, so Arif, would you like to start?
Yeah, so it goes back to those. As soon as these devices can fall under the covered entities, then I think we'll see more of that happening. But when these devices are not, when they're not under covered entities, there are no restrictions in place. So I think something would probably have to happen. On a large scale, maybe at the federal level something along those lines. I'm not sure. It's hard to say. But I know that people are using them on their own, and maybe a healthcare professional may, at this point, I think they offer suggestions, maybe get a Fitbit to encourage yourself to walk more so that you can lose your weight if you happen to be obese or something along those lines. But it's not, but no doctor here in the US at this point, I haven't seen them send a e-prescription, and say that, okay, this is your prescription, buy this app or get this app or, and so forth. So I think it'll take a while before that goes into full swing.
Thank you. Thanks for the comment. So John, what are your thoughts?
I think it's happening now. I've been in hospitals not too far from Riyadh, where the doctor has made the suggestion that certain technologies could help. The patient has then walked from the consulting room into the office of the technologist, who has provided a further explanation of what the doctor has just said, checked out the type of technology the patient has. Patients without that technology have been helped to obtain one from the hospital free of charge for that period. So it's been an integral part of the clinical dialogue. There's a commercial aspect to this, of course, as well. The patient in some ways, may have to pay for some of this, but it does happen. It's not frequent, but I've certainly seen evidence of technologies being used to support what the doctor's done and said.
And for those of the two of you who are based in the UK, because I'm aware there's an organisation that's getting some traction there called Orca, and I believe they're working with the NHS what they do is that they actually do validate apps in the App Store for all sorts of health reasons. Are you aware of that service? Because I'm just, because as soon as those things take off, then hopefully clinicians will be less concerned about medico-legal liabilities or any other concerns that they have, and just work this into their kit bag, their toolkit of what they can prescribe. Are you seeing any of these things yet, Zisis?
Yes, I am aware of them, and I think it's a good way forward. What I would say is, from my side, a lot of the hesitation has been on the anticipated downstream demand that an app might generate. And we've had good examples through COVID and the use of apps in various different ways that allows us now to get a good understanding of what this downstream demand might look like. So that initial hesitation, I think, has been removed to a large extent.
Yeah, thank you.
Sorry,
go on.
Yeah, it's the next step from the doctor recommending how to obtain further information online to the doctor saying, go to the national, go to the NHS site or go to the site from the National Diabetic Society, rather than just doing a random search. So the doctor knows where the curated professional information is. The same will happen with the wearable or the app or whatever it is. The doctor will know where to direct the patient, other than just say there are a whole load of exercise apps out there. Go and select one. I think it might help you to reduce weight.
Yeah, no, that's right. So we've had another question come in, which is, I think, a really good follow-on from what we were just discussing, and that's in regards to health inequalities. So we know that there are, unfortunately, health inequalities that exist from country to country, from region to region, from local as well, and unfortunately, it's not a problem yet that we have conquered at any level. So is there a danger that while that technology could actually increase those health inequalities? And take that question however you wish. Arif, would you like to answer that one first?
Yeah, I mean, Yeah, I mean, we have health inequalities at this point, even prior to the wearables. You know, I mean, and we have that in every countries. I mean, that's a very complex question to answer in terms of how can we improve health inequities. So people that come from very low socioeconomic backgrounds, you know, may not even have the opportunities or the privileges to own one of these devices or utilize them and so forth. So I think that's why we probably, I mean, if healthcare is headed towards this direction, we have to, the biggest thing will be cost. I mean, can we make them accessible to every individual that's out there? So if these devices continue to be at $900 per device or $400 or $500 per device, again, you're going to have a limited group of people having access to them. Louise, I just wanted to say one thing just prior to the last question that I think is that I feel is very important. Now, I believe in like empowering patients. I think that's the technology should empower them. It shouldn't really enslave them. And so what I mean by that is that so you can have these devices, but we also need to focus on health literacy among the patient population. So just having an app or just having a device and being able to read the numbers doesn't necessarily equate with you understanding the medical problem itself. So if we do roll out these devices on a very large scale, or if patients use them very commercially, I would still encourage them to work with the healthcare professionals as they are viewing their own healthcare data. Otherwise, it would be no different than just me going up to Google, typing in, oh, I see a rash on my body. What disease do I have? You know, and then self-diagnosing myself. Now, I may very well get that diagnosis correctly, but I think it would help to validate, right? And that was one of the first questions that you started with, like a validation part. Who's doing it, right? So I think we should just keep that in the back of our minds when it comes to technologies and patient empowerment and even healthcare inequities.
I agree. Thank you for raising that. I think it's an important issue as well and very related. Zisis, what was your thoughts regarding technology, the relationship between technology availability and health inequality?
It's a very well, I would echo what Arif said, in that there is a lot of complexity in this question. I think a lot of the technology has become immediately available, especially in low middle income settings, and has allowed for information to flow a lot quicker than before. However, how that information is used, it hasn't been answered. So I might be in a place where I have a phone and I'm able to access different apps, but there is no linking between this app and the rest of the healthcare system, because sometimes is not even there.
That's right, yes. And John, would you like to tackle this? Have you got an answer for this very complex?
It's always a tricky one, isn't it? It's always the heart-sink question whenever you're sat on the stage and someone asks you about health inequality. I think the question for me is, does it make it worse? Because health equality is there, whether we like it or not, quite sadly. And I think the answer is that providing the things that we've been discussing today are available in mainstream technologies, I think the answer probably is it doesn't make it worse, because people do make choices about what they spend their money on and what they do with their lives, and people are attracted to these consumer electronics, and often they will go without other things in order to obtain such devices. I do, however, think though that as soon as these become device specific and are not within the device that you can buy in the high street and become critical to health and healthcare and well-being, then I think the thing would flip around and the healthcare equality would be widened as a result.
Yes, I mean, because one of the things too regarding the advantages of technology to help actually decrease the inequality, that's there as well. So, you know, some people have access to their own healthcare information, which as they should. However, there is still a huge percentage of the population, and in Australia, for instance, where I am, it is very unusual for people to have full access to their entire clinical healthcare record. We're just not there yet. Other places are more advanced than where we are. But, you know, it's very difficult to be able to say that we're trying to empower people to, you know, have access to be agents of their own lives when we don't even give them access to their health records. So certainly by digitising that information and making it available to people, that actually can help improve the inequalities that exist in terms of just having that access to information. Would you agree?
Yeah, absolutely. You know, I don't want to particularly talk about the maturity standards, but we have tried to build in the patient engagement, personalised medical record, patient control of that record into all our standards. We really do perceive that having the patient as a co-producer, and the patient can only be a co-producer if they have the same level of information that the clinician or other people who are providing care has. You know, that only works when the data is digitised. And you know, when I speak to clinicians who are caring for people who have access to their own healthcare data, every single one of them describe the improved and enhanced consultation, because it just makes the whole conversation much more equal and balanced when the patient has had prior sight of the record before they go in to see the clinician.
Agree, yes. All right, I'm conscious of time, so I'm going to ask you guys for a quick comment on one question, and that is regarding leadership. John, you spoke about leadership at the beginning of your speech, and thank you for that contribution and the importance of compassionate leadership. So I will throw to John first, and the other two gentlemen, you can have a think about your response. Just a quick thought regarding the importance of leadership, especially when we are facing this global pandemic, which is just having impact on enormous, you know, amounts of people and causing all sorts of hardship.
Yeah, thank you. I think I'd make two comments. The response to the pandemic has meant that care providers have had to collaborate across care settings, across social care, primary care, secondary care, and what that means is we require leaders who can manage all systems rather than leaders who can manage single organisations, and that requires a very different set of skills, attributes. So rather than you know, the command and control, we need leaders who can look externally rather than internally. Leadership that is more suited to influence, more use of sandpaper and less use of the hammer. It does take a very different skill set to manage in such challenging times. And I think, you know, the second thing is about empowering others. Organisations or whole systems rarely survive with a centralised leadership strategy. It's got to be devolved. You've got to be comfortable with default decision making at the lowest possible level. And the old adage of having a leader in every seat is certainly what's been a prominent feature of the last 5 months.
Thank you for that feedback, John. So we are over time. I've just had a message from the organisers. So Zisis, I just throw to you if you have any final wrap up, and we'll finish this session. So that's all you'll hear from me. Thank you everybody for contributing. Zisis, did you have anything to say finally?
And just to say, it's been a fantastic session, really exciting talks. I enjoyed the observations from Arif about the wearable technologies, that we need to understand them first before being able to understand the data and what it tells us about the pandemic. And then the take of the more personalized taking of John about the leadership and how the experiences of his close family members have helped understand the better relation between technology and the opportunities therein.
Great. All right. Well, thank you everyone for your contributions for this session. Really appreciate the time. Thank you for sharing your knowledge, and back to you in the main studio.
Thank you.
Thank you.